Good afternoon, everyone. My name is Tony Chicotel. I'm Senior Staff Attorney for California Advocates for Nursing Home Reform. I'm really pleased that you could join us for this town hall. We have some additional agencies represented in this town hall as co-sponsors, and I'll get to that in a minute. I wanted to first let everybody know, because we may have some residents of the facility as part of the town hall, that the town hall is being recorded, and that we ask that you don't include anybody else that doesn't want to be on the screen in your Zoom camera shot, and remind everybody that this probably will be made available, or this will be made available through our website to the public. So just keep it in mind, this Zoom will be recorded. I'll do a couple introductions here. Again, I'm Tony from CANHR. California Advocates for Nursing Home Reform has been around as a nonprofit that advocates for long-term care residents in California since 1983. We have a website, canhr.org, that includes a lot of information, but in particular, about 80 or so fact sheets on various aspects of long-term care, paying for long-term care, particularly related to Medi-Cal. We do a lot of work in the elder abuse world, and then, of course, long-term care consumer advocacy, and with a particular focus on the rights of long-term care facility residents. That would be nursing home residents and assisted living residents. We're joined today by folks from Legal Assistance for the Elderly and BayLegal, Bay Area Legal Aid. I'll go ahead and have them introduce themselves. Carol, do you want to introduce LAE?
Hi, yes, good afternoon. LAE is located, Legal Assistance to the Elderly is located in San Francisco, and we do free legal services for residents of San Francisco who are 60 or older, or younger adults who are disabled. And we do a variety of things. I am including consumer healthcare benefits, landlord tenant, and I'm the attorney who does the healthcare work. Thanks. Thanks for having us.
Oh yeah, thank you for joining. And who here from Bay Area Legal Aid wants to introduce themselves?
Hi, my name is Emma Dinkelspiel. I'm here from Bay Area Legal Aid. I'm a staff attorney here at the Health Consumer Center. We are a wing of BayLegal, provides free legal services to low-income individuals throughout the Bay Area in a number of areas of law. But we also provide specifically through the Health Consumer Center advice, counsel, and even representation to people at all income and asset levels in issues related to health insurance and provision of health care, including long-term care. So that's the function in which we're here today.
Thanks, Emma. And I'll have Elizabeth Zerker introduce herself. She's with Disability Rights California, and she's also going to be speaking during the town hall.
Hi, everyone. I'm Elizabeth Zerker. I'm a managing attorney with Disability Rights California. We are California's protection and advocacy system. We're a statewide organization that does a variety of advocacy and legal work for people with disabilities. And I will be talking a little bit more today about some home and community-based service options for people as alternatives to institutionalization. And I also want to note that DRC has just added a Know Your Rights fact sheet, as well as a sample template letter for folks at Laguna Honda who may want to appeal a placement to use in that process. And the link is in the chat, and we can send it around again for people who can't find it. So thank you.
All right. I think I also want to have the ombudsman who are on in the audience introduce themselves just very quickly and just say a word or two about the ombudsman program. Benson, can you introduce yourself, and then we'll have Blanca from the state office introduce herself if you guys are okay with that.
Good afternoon, everybody. My name is Benson Nadell, and I am the director of the San Francisco Long-Term Care Ombudsman Program. And in addition to receiving reports of abuse and neglect from mandated reporters in long-term care facilities, we're rights advocates. We advocate for good care. We advocate for choice. and we work collaterally with CANHR and other agencies in the city and at the state level. And we have a regular presence at Laguna Honda during this period of transition, so to speak. And my phone number will be at the end of the slide. I'll give it to you right now, 415-751-9788, and I'll put it in the chat as well.
Thanks, Benson. Blanca, are you there?
Yes, I'm here. Thank you so much for hosting this town hall, Tony. I'm Blanca Castro. I'm the State Long-Term Care Ombudsman. I'm here to support not just the local team, but we can also really try to work together, all of our advocates on this call, to make sure that residents and their families know what their rights are as they're either being given information about transfer or have not yet been given information. So I look forward to this conversation, and thank you again for having it and organizing it, Tony.
Oh yeah, you're welcome. All right, a couple of things, some big themes before I get into the actual substance. This is a town hall. The idea is we'll have robust participation from the sponsors and the supporters that you've heard from already, and all of you, everyone else, questions answered as best that we can, and that we'll have a discussion. But unfortunately, I have to go through a number of slides to give information about what's going on at Laguna Honda as we understand it right now. I want to acknowledge at the outset here that this is a very unique situation. Nursing home decertifications are very rare in the United States and in California. Nursing home closures are pretty rare in California. There's no real perfect playbook in any of these cases, but you can really toss any playbook out the door when we're talking about what I think is the largest nursing home west of the Mississippi, or maybe in the entire United States. When this whole thing started, we were talking 700 residents. We've never, at least in my 15, 16 years at CANHR, ever dealt with a facility terminating operations, or at least suspending operations to some extent, of this size. It's a remarkably unique case, and a lot of it's fluid, and a lot of the law here is uncertain, at least around the edges. And in some cases, it's very uncertain down to the core. I will try to recognize uncertainties in my slides where they exist, but please just understand that some of your questions we will not be able to answer. We're just doing the best that we can to guess what the answers may or may not be. All right. What I want everyone to know is two things. I'm going to go through a bunch of slides with a bunch of legal stuff in there. You don't need to know all of this stuff. Hopefully you were sent the slides when you recently, just before the town hall started. We can resend them after the town hall is over. So that way you have the specific information, but I don't want you to be writing down notes and remembering all of this stuff. You don't need to do that. What I'm trying to get through, the main point I'm trying to get through, is that there are lots of protections available for residents in these situations, much more than you would have in a regular landlord-tenant situation, someone who's trying to evict someone from an apartment building. There are significant federal and state and even Laguna Honda specific protections that are in place for residents, and they are there to utilize. The second thing I want you to know, this is my most important message for all of you, all the residents there and the family members of residents, is you do not have to go from Laguna Honda at this time. We'll go through all the processes and protections that are available to you. But you should, what I'm hoping that you will do after this town hall is feel a sense of relief that you have leverage. I don't know how many of the folks that are talking about what's going on at Laguna Honda are talking about the residents' leverage, but that's a place where CANHR, that's an issue where CANHR has a lot of expertise on resident leverage, and I'm going to talk to you about the leverage points that you have. So this is a slide that explains that the 5 sort of subcategories of a nursing home discharge that have to be followed by every nursing home when they're sending a resident out, regardless of the reason. So they have to provide a notice, and I'm going to get into what the notice requires. We're going to talk about the reasons for discharge, which are very important in this Laguna Honda situation. I'll talk very briefly about the documentation, the preparation, orientation, and the discharge summary that are all required before a resident can be discharged from a nursing home. So let's talk about the notice first. The notice must go to the resident in every case. I can't tell you how many nursing home discharge cases I've had where the resident never got the notice. Why? Because the facility doesn't think that the resident can handle the notice. Maybe they think that they don't have the capacity to understand what's in the notice. Nonetheless, whatever the facility's feelings about the resident's capacity are, they are required by law to give a copy of the notice to the resident. Many facilities fail on that. They give a copy to the resident's representative, but they don't give it to the resident. So it has to go both to the resident, and if the resident has a representative, to that representative. And a relatively new law, it's about 5 or 6 years old. The facility also has to send a copy to the Ombudsman program. That's Benson's program in San Francisco. When the notice has to be given typically 30 days in advance. The notice has to be given 30 days in advance if the reason cited is the facility is ceasing to operate. If the facility is claiming that the reason that it needs to do the discharge is there's closure, it has to provide at least 30 days advance written notice with all of the information that we're going to talk about today. There are some exceptions to the 30-day rule. They're in there, but in that, and even in those cases, it has to be reasonably in advance. Okay, this is the stuff that needs to go into the discharge notice. I don't want to belabor this. There's a lot of information that needs to go in. The big thing I think for most of you who have a loved one in Laguna Honda or live in Laguna Honda is the reason and the location. Those are the things that you're going to be most interested in. But then there's a lot of other information, particularly focused on the right to appeal, which I'll talk about later. So these are the 6 reasons in federal law why a resident can be discharged from a nursing home. I think the 2 that we're most concerned about in the Laguna Honda situation is that the residents will be cited for failure to pay, or the facility is ceasing to operate. The failure to pay is the decertification, means that the federal funding, the Medicare and Medi-Cal funding that's paid to Laguna Honda is threatened. The facility is currently getting Medicare and Medi-Cal reimbursement as we speak, but it is under threat. Or they may be saying that we're going to close the facility, which I think is contradictory to the statements of Laguna Honda itself. Documentation, this is some of the stuff that needs to be done before a discharge can occur. Really what this documentation requirement is getting at is to ensure that the discharge is well thought out, it's deliberate, it's includes the opinions of the care team, the interdisciplinary care team. There's been a lot of thought put into it, and that it's safe. And so we want the federal government requires that there be documentation that reflects this deliberation and this concern for safety. Again, I don't want to get too much into all this material. You have the slides, or you will have the slides. Preparation and orientation. Just know that, again, this is a federal requirement to ensure the safety for discharges from nursing homes. This is involving the resident in the discharge plan and the resident's representative in the discharge plan, and making the transition to a new place, if they're going to go to a new place, as smooth as possible. Letting them have a trial visit, letting them get familiar with the place they're supposed to go to, letting them check out whether they think the care there is going to be sufficient or not. Giving as much assurances as possible that this is going to be a good move. And then the last sort of subcategory of discharge requirements is a discharge summary. And I think the key word there is when a discharge is anticipated. And in the Laguna Honda case, I think that every resident's discharge at this point should have been or is anticipated. So all of the residents there now should have a discharge summary in their medical records that has these features. In addition to the federal law about processes, Laguna Honda made promises itself that I think to some extent go beyond what the federal requirements are. This is from the Laguna Honda closure plan and its communication with the federal government. They called for safe, orderly, and I italicized the words clinically appropriate transfers and discharges. That's a related but somewhat distinct criteria for the transfer discharge assessments, that they have to be clinically appropriate. So I would argue that someone who's receiving nursing home services today is almost certainly clinically inappropriate for a homeless shelter placement tomorrow. They're also mentioned, Laguna Honda mentioned 4 different assessments, all of these separate. A concurrent assessment, I'm not really sure what that means. A medical nursing assessment, a social assessment, and an MDS. MDS stands for minimum data set. And a minimum data set is the federal government's way of collecting data about a nursing home resident's care. And it's very extensive. It has hundreds and hundreds of data points to assess what kinds of care the residents need in a facility. So they're also supposed to be getting these MDS assessments redone at least every 3 months, I think was what Laguna Honda called for. And then there was this quote about getting a notice of proposed transfer discharge after each patient assessment is complete. I'm not exactly sure what this is promising, but it sounds like it may be something in addition to what the normal transfer discharge notices that residents get. So I added it in there. For facilities that are closing, for nursing homes that are closing, there's special law. It's in the Health and Safety Code. And there's these additional requirements. A community meeting within 30 days of the closure plan. Benson, has this requirement been satisfied? I've heard references to community meetings. I'm not sure if they've taken place. Benson, can you tell me if there's been a community meeting at Laguna Honda that came out or that was within 30 days of the closure plan being issued?
There was a town hall meeting.
Okay.
It probably came sometime in June. The first town hall meetings were for staff and people working there. And then there was one for members of the community, inviting some family members. And then there was a second one this past Monday evening, I believe. But those are not what I think of as community meetings because they were virtual, like this one is, of course. And I don't know how inclusive they were in terms of participants. So they did have a community meeting, but I put a caveat on the word community.
Okay, thanks for that. In addition, the arrangements have to be made for future medical care and services. And what I was seeing was if a resident's leaving under the cloud of facility closure, doctor appointments have to be set up and arrangements made to make sure that the resident's going to get to those appointments and have their and basically have a seamless transition in their medical care. All right, I want to talk real quickly about the appeal process. And we definitely recommend that residents utilize this process when they're issued a transfer discharge notice. And keep in mind that the closure plan that was sent to the residents is not a transfer discharge notice. A transfer discharge notice has to have all of those elements that I talked about before: the location of the discharge, the date of the discharge, the reason for the discharge that's specific to this particular resident, and then all that information about appeal rights. So once you get that actual individualized resident notice, you have the right to appeal it. And I put the phone number in for the Office of Hearings and Administrative Appeals. And just, there may be some questions about how the appeals are conducted. I would say it's somewhat informal when you're talking about comparing it to a court process, but very formal when you're comparing it to a meeting. It's on the record. The hearing officers will swear you in to tell the truth, the whole truth, and that whole kind of thing. There's a presentation of evidence. There's the right to cross-examine witnesses. There's a right to provide evidence in support of your arguments in advance of the hearing. So it's a administrative hearing, something like a courtroom, but not quite as intense as a courtroom. There's no hearsay rules, for example. The transfer discharge cannot be conducted while the hearing decision is pending. So that's real important to know. Specific to Laguna Honda, I think these are important things to know about the appeal process. If the facility is citing that it's not getting paid for the resident, that's just not going to be true, unless for some reason the residents lost their benefits. But collectively, the Laguna Honda is getting paid by Medicare and Medi-Cal through September. So that they have an extension to get paid through that time. They should be getting paid for all the residents' care. I did see a discharge notice today that cited that the facility is ceasing to operate as the reason. I don't think that's legitimate. And if you got to look at Laguna Honda's own statements, their written statement says something to the effect of this, like a frequently asked questions thing they put out. Our highest priority is to recertify and keep it open. That's not ceasing to operate when you're keeping it open. And then the San Francisco Chronicle quoted the current, I think the interim CEO of Laguna Honda, Roland Pickens, is saying that we're going to keep it open. So it's not ceasing to operate. So I think just if you have a discharge notice that says you're being discharged because we're ceasing to operate, I think you have a great defense that the reason is not in fact valid. Yeah.
Tony, I think that when will you take questions? There's one person who's had their hand up for.
Oh yeah. So I'm hoping to take questions after we do the slides, and we'll have plenty of time for questions, I promise. If you have something that's a clear point of clarification, just please put it in the chat for now. Thank you. The other issues with the Laguna Honda specific discharges on appeal is if the proposed location is a homeless shelter. In some cases, the facility calls them a navigation center. I think on its face, that is an unsafe, inappropriate discharge for many reasons, but the primary reason being that this is a person for whom Laguna Honda was getting Medi-Cal money to provide nursing facility services to. And now they need no assistance at all with activities of daily living. They're going to go to a place that is devoid of services. I heard yesterday in the stakeholder meeting this term wraparound services. What's a wraparound service? I think I don't know what that means. It may mean some case management, but it's certainly not someone who's going to help you get out of bed. It's not someone who's going to help you brush your teeth. It's not going to be someone who toilets you. It's not going to be someone who helps you bathe. I can tell you that's not a wraparound service. And those are the kinds of things that Laguna Honda is getting paid for residents there who are covered by Medi-Cal. Another issue with the notices, and the one that I saw today, is they're backdating the notices to May 16th, even though they're issuing them in July. That's a no-no. Some other stuff that's coming from Laguna Honda that's very concerning is this idea that if you appeal your discharge, your benefits may be cut and you may be charged out of pocket for your stay there. That was even in the stakeholder meeting yesterday. That was acknowledged as wrong, incorrect. Medi-Cal coverage will be provided regardless of whether you file for your appeal. I did see in the closure plan that included the exhibits a sample discharge notice that included this statement in there. I think that would make that discharge notice defective on its face. The discharge notice I saw today that was issued in July did not have this statement on there. So I don't know if that statement will show up on future discharge notices or not. I'm expecting that it will not. In addition to the federal rights for nursing home residents, the right to appeal, the promises made by Laguna Honda, the requirements related to facility closures, residents there are also tenants. They have all of the same rights that tenants do. California would be violating Americans with Disability Act law if we offered the kinds of protections we have for tenants, and we don't offer them to people with disabilities who live in institutional settings. So the rights for residents to stay in their facility until they've been lawfully evicted apply. And just today, sort of in a great spark of timing, Attorney General Bonta issued a press release about new guidance to law enforcement officers about self-help evictions. Facilities, landlords may not engage in self-help evictions, meaning they can't shortcut the court process to remove a tenant from their housing without their consent. So even if a resident has lost their state appeal, the appeal hearing decision comes back and says, oh, we think that the reasons here are valid, this resident has no right to stay. That doesn't change very much legally speaking. It doesn't authorize Laguna Honda or anybody else, including law officers, to take the resident and move them against their will. The facility still has to go to court in order to do that. And I think that's a really important point that everybody should know and talk about at Laguna Honda. Even if you lose the hearing, which I don't think is likely to happen, but it could certainly happen, you have the right to stay on your terms until you are lawfully evicted through a court of law process. That's my bottom line slide on the landlord-tenant stuff. Oops. All right, so some of the stuff that we don't know about that I think should factor into these decisions about what residents or their family members should do. The 60-day notice of the closure or the idea of a closure comes on July 15th. I think there's been some indications that the discharges of residents may accelerate following July 15th. So be on the lookout for that. That's one of the reasons why we wanted to have the town hall this week. Laguna Honda has promised that everyone would be out by September 13th. I don't think that that's going to be the case, but that's what they've promised. Laguna Honda may fail recertification, and I probably should have spent a minute or two outlining exactly what the situation is at Laguna Honda. But very briefly, what's happened right now is Laguna Honda has lost its federal certification. It is hoping to regain certification through a two-step process this fall. But there's no guarantee that it will be recertified. And if that's the case, my understanding is that the facility will in fact have to close because they're going to lose all of their federal funding. What's available today may not be available tomorrow. I think some of the residents have already been led to believe that they should get out now while the getting's good. Placements that are available in the Bay Area may not be available in September. And in that situation, you may have to relocate to Southern California or to Nevada or somewhere like that. So it's certainly, I think that concern is a little overblown, but it certainly should be a consideration. I also want to mention that Laguna Honda, like anybody else, is capable of playing dirty. The backdating of notices, for example, I think is a little bit dirty. But we've represented a person at Laguna Honda who had the police come and take him out after he was given a discharge notice. He hadn't had his appeal, and the facility had not gone through any legal process, unlawful detainer process, a landlord process to remove this resident, but the cops enabled the self-help eviction by Laguna Honda as opposed to stopping it the way the Attorney General has asked law enforcement officers to reminded them to do, that they're supposed to stop these self-help evictions, not enable them. So that's a bit of a concern. And there's no, people always ask me, well, what are they going to do? And I say, I can never tell you exactly what they're going to do. I can tell you what's legal or not. Sometimes folks do things that are illegal. So here's what I think is likely. Each of these points I think is likely, but collectively, are all of these things likely? I'm not so sure about that. There's uncertainty with all of these things. And that all of these things will happen is certainly less likely than any one of these things happening. But I think the facility is going to be pushing for discharges more than ever in the next couple of months. I think it's really going to start happening after July 15th. I think the residents that file appeals are going to win their appeals. And I base that on years and years of experience doing facility discharge appeals. I know that residents win a great majority of the discharge hearings. This is a unique situation. I can't guarantee that hearing officers are going to side with the residents on these cases. I can't even tell you whether or not that the state is going to actually hold these hearings. There's been some uncertainty about whether the state is going to honor the appeal rights of Laguna Honda residents and hold hearings for them. But I think it's likely that they will win their appeals. I think it's likely that there will be residents on September 13th or September 14th in the building when CMS, the federal government, does its next recertification survey. I don't think that the facility is going to be bereft of residents and have successfully discharged all the residents out there. I think it's likely that Laguna Honda will be recertified. I know a lot of resources and efforts are being made to get it recertified. I think the federal government understands that this is an important facility, an important resource for the entire Bay Area. I think everybody's rooting for it to happen. Certainly not a guarantee that it will happen, but I think it will likely be recertified. And the residents who have remained there will stay there. All right, Elizabeth, you want to mention some of these, when we're talking about discharges, of course, it's not just from nursing home to nursing home. There's a lot of other care providers out there. Elizabeth is going to mention some of them.
Hi, thank you, Tony. And I did want to just say, one of the things I want people to be aware of is we have a sample appeal letter that is on our website that family members can use. We have heard from the state that they consider the two appealable issues to be the placement is inappropriate, or the person has been determined not to meet level of care, and that those are the two things you can appeal. And I know that Tony's given a lot of the federal rights about what you have the right to appeal, and I just want to caution people to really, when they're making their appeal, keep those things in mind, because if you appeal and simply say, I got a notice that the facility is closing, you may get the response, which we don't agree is correct, but you may get the response that you don't have a right to an appeal, and that's going to make things more complicated. So I would really be focused as you are trying to keep your loved one from going to a place that you don't think is appropriate, to make sure you address issues of the quality of care of the facility, the things that you're concerned about, and not just that the facility can't discharge me just because it's closing. Because I think we do not have a meeting of the minds with the advocacy organizations and state and CMS, and so you may get roadblocks in that regard. But I did want to just raise some of the various community-based services that are available. There's a bunch of links here. But if you are a family member, if you have a family member who's at Laguna Honda and is a Medi-Cal eligible individual, which most people at Laguna Honda are, there are a number of what's called home and community-based services that are funded by Medi-Cal that are available to keep people in their own homes. So if you're someone who might have space for your loved one, but thought that you couldn't help them stay at home with you because it was too expensive, you couldn't pay for their care, I just want to make sure that people are aware that there is a variety of other services that include in-home supportive services, which is personal attendant care, and people can get up to 283 hours of care per month. That can be provided by a family member. Anyone can become an IHSS provider. There's something called the Home and Community-Based Alternatives Waiver, which provides both attendant care and can provide attendant care above the 283 max, up to 24 hours of care, as well as some case management and nursing. There's a program called California Community Transition, CCT, and they're the program that helps people, that reaches into facilities and helps people get discharged home. There's the assisted living waiver, which is helps people kind of in boarding cares with additional services. There's something called the Program of All-Inclusive Care for the Elderly. And then there's also community-based adult services, which are center-based care that people can live at home and go to. This is a ton of information, and we don't have a lot of time for it, but I really wanted to make sure that family members who are on this call and residents who may have a place that they could go to from Laguna Honda right now are aware of it. Part of the problem with the timeline that we're looking at for the closure plan is that transferring from a skilled nursing facility to the community requires a lot of planning. It requires an accessible, affordable home to go to. So I'm just trying to flag for family members that if you have ever thought that you would like your loved one at home, but thought you couldn't do it, there's actually an array of services that are available. And I just want to make sure people know about them. I'm going to put into the chat some of our consumer-facing fact sheets about some of these programs, because they give a little bit more in-depth description of them, so you can see if those might be programs that might meet you or your family members' needs. And so I think I'll leave it there. But I wanted to make sure people were aware of these other alternatives to nursing facility placement.
Yeah, thanks, Elizabeth. I have a slide that will illustrate this in a little bit, but what I've been telling some people is use this as an opportunity to find a better placement. Because for a lot of residents at Laguna Honda, there probably are better places, more appropriate places for them to go that better balance their care needs with independence and being in a non-institutional setting. And these are many programs that can maybe help people find something that may be more suitable for them. All right, so I got 3 scenarios I want to go through just to give some people some ideas of what I think residents should be doing. Here's a situation where a woman's been at Laguna Honda. She's really tied into San Francisco. She has significant care needs that can't be met in a home setting. She's generally happy there. Laguna Honda offers a placement in Los Angeles. The facility has a bad track record. This is my version of a no-brainer. In July, are you going to take this placement? I say absolutely not. If you've got family, you got strong connections to the San Francisco Bay Area, they're offering a placement where those relationships would almost be destroyed into a bad nursing home where you're probably not going to do very well. Don't take it. The better things will come along than that, almost assuredly. And it really can't get much worse. This is my second version of a no-brainer. This is a guy who's at Laguna Honda and not really liking it. And there's a placement found that's in the community and can be paid for and seems to better balance his needs with his desire for independence. To me, this is a no-brainer. Go on. Yeah, get out of there. That's a pretty good outcome for somebody. And I think that there's a lot of residents there who may have better options that are available to them. Then this is the tough call. This is the one where I think you just have to, the decision makers in this case scenario have to be very deliberate and consider all the uncertainty. So basically it's Elsa again. She's in San Francisco. She's connected to San Francisco. She likes Laguna Honda. Her family likes Laguna Honda. But there's a placement in a nursing home in Burlingame, not Los Angeles, much closer than Los Angeles. There's a lot of factors in here. We'd have to go through a lot of detail before I could really make a recommendation about what I think this person should do or what I would tell this person I would do with my own mother. But this is a tough one, admittedly a tough one. So what to do now? If you get a discharge notice, file an appeal. And Benson, I'm sorry, I didn't put your phone number in there. If you want to put it in the chat again, now would be a good time. The Ombudsman is required by law to get a copy of every discharge notice. So they should already have a discharge notice if you're calling about it. But I think it would be good to check and make sure that that requirement is being satisfied. I have a reference to Disability Rights California's sample appeal in their Laguna Honda rights page. There is a petition to stop residents being discharged from Laguna Honda. I have the link there. And then I've got the contact information for legal assistance for the elderly and BayLegal and for CANHR. CANHR, we definitely want to know if the state is telling you you don't have the right to appeal. We definitely want to know about that. if you have a discharge notice and you're not sure if it meets all the legal requirements, we can take a look at it. If you want some help getting prepared for a discharge hearing, we may be able to help you with that and our partners here. And at this point, I'll ask LAE or BayLegal if they want to say anything, add anything about what services they could or couldn't provide.
So the Health Consumer Center, we're open at the moment. We're open 9 to 1. We 5 days a week, excluding federal holidays. And if you give us a call, you leave a message, you'll get a call back that same day, as long as you call within those open hours, in almost every instance. And usually much faster than that. We're pretty good about uptake. We can, if you're eligible for our services, and like I said, because of the lack of income and asset restrictions on our line, most people will be, we'll be able to provide you with advice over the phone in most instances, and we'll sort of take it from there, see what we can offer from there. We definitely do want to hear from you if you have, just like CANHR, if you are worried about the legality of a notice that you've gotten, you're not sure, that you feel comfortable, not navigating it without advice. That's the kind of thing that we can talk to you about. So please give us a call. We can also talk about other, issues. You're wondering whether you get an IHSS. You're thinking, oh, I want to take my family member home, or you're a family member applying, and you say, you apply for IHSS for them, and you get denied. We can also assist with that kind of thing as well. Make sure that you have if you are the person in question, if you are the resident in question, we need to hear from you directly, or we need the power of attorney on file. Otherwise we can't advise. So make sure that the resident is ready to either give consent or that you've got a power of attorney on file if you want somebody else to do the talking.
Hi,
Thanks,
this
Emma.
is Carol from Legal Assistance to the Elderly. And much like Emma was just saying about Bay Area Legal Aid, it seems like virtually every resident of Laguna Honda will qualify for our services. So if they want advice or assistance, definitely they can call us. As I mentioned, I'm the healthcare attorney here, so I would probably be the one talking to the person. And we may be able to represent people if they want to file an appeal. Obviously, if I get 600 calls, I can't represent 600 people, but so far that's not an issue. So do call. And if I can't represent, as Emma was saying, we can advise, we can go over these issues that have come up today. And also we're expecting there'll be new issues because, as Tony was saying, they seem to be changing their notices at Laguna Honda. And so we're not entirely sure what they're going to do. So there may be new issues that come up also. And if you call, we can go over that. And as I said, we may be able to represent, and all of our services are free. So do call. Thanks. Oh, in terms of hours, we're basically 9 to 5, Monday through Friday. Outside of those hours, you can leave a message, and as Emma was saying, we'll get back to you pretty quick.
Okay, thanks, Carol. Thanks, Emma. All right, that's it for the slides.
Hi, can I ask a question?
Yeah, go ahead.
I'm in Laguna Honda.
Hi.
I'm on South 2. And, I'm supposed to be going to Peter Claver, but I'm probably only going to be there for like 2 weeks. And I don't know if I should take that place. I mean, because why not just stay here for the 2 weeks?
Well, okay. I don't know what Peter Claver is. Is that a?
It's like a assisted living.
Okay. Yeah. Your name's Daniel?
Daniel Jewell, yeah.
Yeah, Daniel, since this is so specific to your circumstances, I would recommend you just give me a call and we can talk about it after the town hall.
Okay, I'm sorry.
Particular circumstance. No, it's perfectly fine. I just think that because of the each resident's circumstances of whether a placement is going to be good for them or not are so unique, you should probably do those one-on-one rather than in the town hall.
Okay. This is my first time ever doing this, so.
Oh, that's okay.
And Daniel, I can look for you on South too if you want. I'm Benson, the Ombudsman.
Oh, okay. That'd be great.
So I want to say something before we as the ombudsman, it's good for family members to participate in those assessment care plan meetings that are being held prior to looking for placements throughout California or the 9 surrounding Bay Area counties. It's good to participate and ask for documents. If you have the authorization to get documents, you need to ask the documents. Family members need to be ahead of the curve on this rather than waiting for the notice to drop in and where the response time is going to be so much more immediate. Residents and patients or residents and family members have the right to participate in care plan meetings and ask questions and get copies of any of the documents that are being developed that they transmit to these other unknown receiving facilities. So it's good to be prepared even before the appeal thing is even considered, because you may not get the notice until a week before the date of discharge at best.
Yeah, what I would add is, I tell this to people all the time, this is a big decision, especially for folks who have been in the facility for a long time, many years, and developed lots of relationships with the staff. And you can never be sure if the next place is going to be good or bad or roughly the same, but you should have peace that every question that could be answered is answered before you make the move, within reason. So if you're unsure, if it feels like you're being rushed and you don't have the kind of assurances that you feel would give you the peace of mind to make this move, my advice in July right now is don't rush, don't make that decision. You've got some leverage, you've got some time. If it's one of those no-brainers, and this is a good move, take it. But if it's not and you're uncertain, and despite asking questions, no one can really give you the answers, my advice is to stay put.
Okay. Hey, Tony.
Yeah.
Alrighty. So I'm gonna let the 2 people who have their hands raised go, and then after that, I'll go over to the chat for questions. So Camellia Breed, if you'd like to unmute yourself. Thank you.
Hi, I have a father in Laguna Honda who gets very good care. I am a part of the quarterly meetings about care planning. So me and my siblings were already up on it. They did the assessment when other facilities came to check my father. I was very clear with the social worker and the people on the floor that I wanted to be there during the assessments, and they weren't communicating with me when the people came. Then, like said, I was given a notice a week ahead of time saying that a certain place had chosen my father and said they would accept him. I was very upset, and I went to check out the facility. It was horrible. I was able to enter the facility. I wasn't being asked any questions or, who was I visiting? It smelled horrible. So I'm a little frustrated because how are they discharging patients to facility that would possibly put them in worse positions than they are? The thing with my father is he's totally not mobile. He can talk, but there is nothing he can do for himself. So he needs a high level of care. And his roommate didn't have family, and he was moved and he died this weekend. And after reading the reviews, yes, and after reading the reviews and visiting the place, there have been over 8 deaths in that facility that they were trying to send my father to. So, it's kind of upsetting to be rushed. I didn't know they were backdating letters, but at this point, I did deny. And I wrote a long letter to the social worker, just for anybody else that has family members. I wrote a long letter describing my findings, and we were put on hold. But the social worker did tell me that the next place that says that they will accept him, he's going to have to be discharged. Now, is that completely true?
No.
No,
No.
that's not true.
You,
Yeah.
you
Thank
should,
you for asking that, Camelia. I'm the other sibling as well that co-helps with our father. Yes, we were very displeased about the way things were handled, how rushed everything was taken care of, and then it's like it was little input given from us, where it was
It was
felt very
literally the
rushed.
week before. And when I walked into the facility, you can smell like the old mold and a urine smell. And I'm walking around just observing and also taking pictures. And like the assistants and the people who were there, they were just on their phone in their little MA station. No one's talking to me, stopping me from walking down the hallways. It was really ridiculous. So, second part to that question, thank you guys for answering no. They said if he was to move out and Laguna Honda did pass and they were able to get their funding back, that he would have to reapply all over again. Is
Yep.
that true?
That's what they told us.
Yeah.
That's what
Tony,
they
you wanna-
said. They said, and then I said, well, if you guys are redoing it in December, why can't you guys just let the people who are in that state stay there to see what happens in December? Because my father needs full care. He even needs a person to feed him. So that's what I'm just a little confused. And for him to have to reapply all over again, it took us almost 5 years to get him in this time.
Yeah, it's a real disheartening situation, and it just feel like it should be some more processes set in place so that people can be able to be expedited in, because the fact that we might temporarily have to take him on, it's not fair that when the facility opens back up, we have to jump back into this waiting game long term, and just waiting this out. This is unfair, and I hope that, I'm not sure if everybody else can echo these same feelings or situations towards the matter, but at this point it's been a real disservice to us and unfair.
I just wanted to know what facilities that was like stinking and stuff.
It was called Burlingame Facility Living.
Oh, I've heard of that one. Yeah. I've heard of it.
And I just want to give it a chance, because I understand things happen, because all the people who work with my father, they're stressed out too, because they're out there looking for jobs right now too. And they have mortgages and families as well. So it made me go out there and look, and I'm just like, oh no, like
I have a question.
Laguna Honda is like heaven almost, they take very good care of
Completely.
my father.
Burlingame is one of the major facilities that they're trying to dump residents of Laguna Honda in. That is a Brias Rockport facility. They've been trolling for residents. That and homeless shelters seem to be the primary choices of Laguna Honda of where to transfer people at this point. And you can just say no to that.
Yeah, a couple things I want to respond to. On the idea of reapplying, I think you mean to get back into Laguna Honda. I'm pretty skeptical of the chances of residents who leave getting back into Laguna Honda, assuming that at some point it is recertified. I would definitely ask any of you who are presented with that option, hey, just can you take the resident for a couple of months, or go to this place for a couple of months, and then we'll get you back as soon as we can. Get that in writing and then send it to me, and we'll review it together to see how enforceable those promises are going to be. But I'm skeptical.
I hate to interrupt you, but they haven't given us anything of writing to that nature.
Yes,
Well,
the social
yeah,
worker.
that would
she
be
wouldn't-
step one. Step one
she
would be to
wouldn't
get it in writing.
Social
that's an
worker
offer
wouldn't
they're
give it to
gonna-
me in writing, but that's what she told me, that all residents who exit will have to reapply, even if they get their funding back.
Right.
So I wrote them like a 2-page letter explaining
Ridiculous.
my findings, and the social worker, I CC'd her boss and put pictures of the facility. And the thing about it is, my father is already at the end of life. I'm not trying to put him in a place that's going to make it go faster.
Yeah, and the other thing I want to mention is something that you did that's really great, is you put your concerns in writing and even brought some photographic evidence, which is great. I would recommend, this is something we recommend to residents and their families all the time, is to put what your criteria are in writing, or your concerns about a particular placement in writing, so that you're not just being oppositional, you're being collaborative. These are the things that we need in place for this discharge to be safe and appropriate. One is, the location. 2 might be whether it's affordable. 3 might be the track record. Are they going to be able to provide the right level of care? When you start to put those things in writing, you're setting up a roadmap to where you look like a reasonable person.
Where are our politicians when all of this is going on? Where's Nancy Pelosi? Where's Dianne Feinstein? What's the mayor doing?
I've sent letters to all these people and sent to the supervisor for the Laguna Honda district. I haven't heard back from an assistant to one person, and that's it. And, I'm ready to get out there with a sign soon myself, but I have a couple of questions.
Sorry, we've had one person who had their hand up, so let me just get to them first, and then
Okay.
for everyone else, yeah, please raise your hand. Thank you.
It's up, but I don't see a little yellow one.
So let me just get to Theresa Palmer first,
Okay.
because she has had her hand up for a bit.
Laguna Honda.
Hi, can you hear me?
Yes. Go ahead,
Okay,
Dr.
my
Palmer.
main concern is when, my experience with nursing home is when they plan a care team meeting that family is supposed to come to, they often don't plan it at a time or a day when working family can actually come. And then they'll say, and then you'll try to be in the care meeting by phone. You won't really understand what's going on. And then they'll say that you were there and you approved what was going on. So what are the family rights in terms of care team meetings and participation? Can they be after hours? Can they be on weekends? I mean, working family can't make it to midweek care team meetings.
Hey, Theresa, I had the same problem, and I had to get a little aggressive with them. And even though I couldn't change the time of the care team meetings, when they did have them, we did them over the phone, and I made them slow down, and I wouldn't let them rush me into things. And I also requested that the social worker send me the documentation by email, since they can't accommodate my time. Now, that may or may not work for you, but that was the only way I was able to work around it.
Yeah, I think families need to be told not to be intimidated. And also, I wonder if some kind of Facebook group or Google group would be helpful to families to help each other. I don't know, something.
We want, hi, everyone. Thank you so much for your comments and your questions. I want everyone to understand, if you are new to Zoom, we have 140 people on today's presentation, so we can't have people just shout out their questions. If you know how to use the hand to raise your hand, it's on the reactions menu, which looks like a little happy face with a plus sign. Sometimes you have to push the 3 dots if you're logging in from a phone. We really would help, that would help us tremendously. So now we're gonna go, we do have a couple people who have been waiting. So we're gonna first, and we ask you to please keep yourself muted until we call on you. So we're now gonna go to Theresa Hoskins Ford, if you'd like to unmute yourself.
Hi, thank you. So I have a family member there. I'm his aunt and his court-appointed conservator. So my question is, when Laguna Honda first told me about this, one of the things that they mentioned is that, well, you know, there's no beds here in the Bay Area, so he may have to be moved to LA. And I told them, like told them twice, that that's not going to happen. So I just want to make sure that, and someone mentioned about putting in writing and a paper trail, if that's something that I should be doing, because I don't have any family in LA. I don't have a way to get to him if something happens to him in LA. So I want to make sure what are my options if they approach me again with, you know, telling me that that's the only place that they can move him. And I know you're saying you don't have to move, but what do I do here? What should be my plan of action here?
Yeah, a couple of things. Thanks for the question. I think it would be good to put something in writing preemptively to say that anything outside of this number of mile radius is not going to be considered by me, just
Okay.
because it would completely destroy our relationship that I have. And I'm as this person's decision maker, I need to be able to review the care provision so that I can make good decisions on their behalf. Putting that in writing, sending it right away, I think would be a good idea. Obviously, if the facility has a placement location in mind, they're going to have to give you a discharge notice with that placement location written out, and then you can invoke your appeal rights in that scenario.
Okay.
I also want to mention that I did a little research today on the federal government website. Every nursing home since COVID started is reporting a number of data entry points each week. I looked at the nursing homes in San Francisco. As of June 26th, there were 334 empty beds in nursing homes in San Francisco. So there was 334 bed capacity unused, at least 334. There were a couple nursing homes I wasn't able to get the information from or didn't report it, but at least 334 available beds in San Francisco on June 26th. So there's not really so much a capacity problem in San Francisco. There is a problem of money. It comes down to the fact that these facilities do not want to take residents who are coming in long-term with Medi-Cal as their primary source of payment. And that's something that I think the state and the federal government need to work on to basically browbeat the San Francisco facilities into not breaking the law and discriminating based on payment source, and allowing some of these Laguna Honda residents to come in and stay where they need to be in San Francisco.
Tony, can I just respond to Theresa a
Yes.
little bit more too? Please do go to our website. We have a sample appeal letter that addresses like inappropriate away from my family and support as a reason for appealing. That's a very important thing to emphasize in your situation. It's absolutely inappropriate for your family member to be sent to Los Angeles. And I encourage you to also reach out to your state legislators around things like this.
Okay.
Because the people in the California legislature can be helpful raising the profile of all of this. I mean, I think that we can say that on the stakeholder meetings we've been having with the state and CMS, I think the more pushback on some of these things, the better. But what we're hearing specifically is that the state's attitude is like, these are sort of individual situations we heard, and then we drill down and it's not that. And so it's all going okay. And so I really think that it's important to have your voices in these individual experiences and reporting them to the Ombudsman and others so that we can bring that back to the state agencies.
Okay, thank you so much. I appreciate that.
Alrighty. Next, Deborah, did you want to unmute yourself, please? Thank you.
Thank you. My son's been a long-term resident of Laguna Honda for almost 20 years. He is ambulatory, but has incredible cognitive issues and would not understand what is going on. And I'm also his conservator. I might be working out of town in the next month and a half, so I wonder how to be best prepared when I'm out of town if I have to raise an appeal, so I can take any appropriate kind of paperwork or anything that's in line with that, so I'm ready to do it from there. I would fly home for a day if I had to, but this is coming up. And when I was in his care conference, which I thought at first was going to be a discussion about the future and moving on. And then they really just talked about his usual, what's he's eating, his weight, and all of those things. And then I talked about this and whined and got scared. And his doctor was on speakerphone. And she said, Mrs. Bauer, your son does not have to leave Laguna Honda Hospital unless it closes. And this is what his medical doctor said to me. So I've had that lodged in my brain, and then operating on that air that, that's possible. I also just wanted to thank everybody here for your care and really preparedness. And this has been really edifying for me, and I really, really appreciate it. It's been much better than the 2 Laguna Honda town halls I've attended, where I've basically just was angry during them because I felt they really just kind of pushed it all on you and told you how to do it and hurry up and make a fast decision so you don't lose the best bed possible. And thank you so much. This was really, I really appreciate all your commitment to what you do also. Any suggestions on if I have to appeal from Chicago?
Yeah, well, thank you for that, Deborah. All of the appeal hearings now are done virtually.
Okay.
Over the phone. They don't even use Zoom or an internet interface. It's just like a phone number kind of thing you call in. So it can be done from anywhere.
Okay.
I don't think that there's anything in particular that you're going to need to bring with you.
Okay.
If you get a notice and you decide to appeal, then you can get in touch with CANHR or one of our partners, and we'll do the best we can to get you prepared for that hearing, no matter where you are.
Yeah, I mean, I've probably been there 6,000 times. I'm a maniacal regular visitor and a presence, and talk to the staff a lot. And so I really appreciate what they've done too, but I'm terrified. I'm terrified. I'm terrified he'll be moved and he won't know where he is and he won't know where I am, and he wouldn't even ask, where's my mom? It would just be going on in his head. And it's terrifying.
I'm sorry that that all of you are having to go through that. I want to add that I recommend that you write to them now and say, I'm going to be traveling. I expect any notice to come to me as well at this email, and just put it in writing now that you need that. It needs to be an email, so it can't be a hard copy to your house or anything like that. So I would preemptively do that.
And Deborah, could you copy me, Benson, at the Ombudsman program, so
Yes,
that there's some acknowledgement that it was sent? In case they do not respond, please copy me.
Okay, thank you so much, everybody.
Thank you, Deborah. Okay, next up is Moying Zhu. If you'd like to unmute yourself, please.
Yes, I'm a resident storage. My mom need the total care in Laguna Honda, and I'm the only child in the U.S. I'm live in the Bay Area, and my dad he is almost 85 years old. If they want to place my mom to any areas cannot reach my dad, that is a really sad story to us. I don't know how to, to make arrangement for my dad to visit my mom. All this stuff happened. So I also had the local ombudsman case with my mom's about her care. So may I contact them for follow up the information about the relocation or discharge plan or something. So far, I did not get any information from where my mom is going to discharge to yet. So I will get a really close contact with the social workers department. So I just really want to know if this is the case, if they had to send my mom to really fast, or my mom said she not gonna go anywhere. She gonna stay in Laguna Honda as long as she can. So do you have any idea for my mom's idea? Thank you.
I certainly think this is going to be a difficult decision for so many of you. And if there is a huge barrier to a Laguna Honda resident being sent somewhere out of the Bay Area, out of the community where you can go visit them regularly, then I think it increases the the considerations you should make for a placement that's in the Bay Area now. As I said before, I do think that Laguna Honda will likely be recertified, but there's certainly no guarantee of that. And if they're not recertified, my understanding is that it will close. And in that situation, the time is going to be very short for moving the residents out, because I think we'd start worrying about the staff members not showing up for work. So if location is preeminent in your mind about keeping them in the Bay Area, and there's a Bay Area placement that's available, it's a consideration. I think you should strongly consider it now as opposed to later. But then you get into other, of course, criteria of, is it a safe and appropriate place? Are they going to be able to provide the level of care? Is it affordable? Those kinds of things. For all of you, it's going to be very individualized, but I want to reiterate, if it's placement is paramount, then, and you get a placement that's close, relatively close by, I think that would be more in the, you should be more inclined to take it now.
But the other question, I think, Tony, was what to do if the placement offered is far away. And I think the answer to the daughter who just spoke is, you should file an appeal and you should say, I and my mother, my dad live in the Bay Area. My mother will be irreparably emotionally harmed. Her health will be at risk if she is forced to be sent to a faraway county where we can't visit her. I want to also note that DRC, Disability Rights California, is working on and should have translated versions of these fact sheets, which right now the English version is the only one up, but we're translating them to Spanish and other languages. To the woman who just spoke, if you wanted to, if you have, maybe I can get your email from CANHR and we could make sure that you have documents in another language, if that would be helpful for you.
Yes, and I just wanted to say quickly, I'm sure that this is true for all of the agencies who've spoken here today, but we have an interpretation service, connected with the HCC. If you call in and you need advice in, there was a question in chat about, how can you get this advice in Spanish? If you call in and you speak Spanish, if you call in and you speak any language in the state, really, I think I have only once encountered a language we couldn't serve. With a very, very, very small population of speakers, we can use our interpretation service to provide competent legal advice in that language. We also have attorneys who speak Spanish and Vietnamese specifically, as well as possibly others. So.
Thank you, Emma. And there was one, Glenda Lewis, if you wanted to unmute yourself. I know I had missed you earlier.
That's okay. I have the same problem as the first lady. My brother-in-law is there. He's been there like 10 or 15 years. He's 100% dependent on someone to help him. And my issue is that they gave me a list of some healthcare facilities that they want him to send him to. But I told the social worker I wasn't comfortable because I would like for him to be in the facilities where if he needs to go to the doctor or he needs a haircut, he can get all that there, other than them having to take him out the bed because they got to host him out on that thing because he can't move, and then take him to a doctor's office, and then I have to worry about getting paratransit. That is very stressful on the members. I mean, the family. So I'm just really upset with Laguna Honda right now. So can you help me? I'm in the Bay Area. And the list they gave me, all these people, when COVID came out, it was just awful. So I don't know what to do with it.
Well, I'll say that all of the considerations you have about your loved one's care being taken care of, or his care needs being taken care of at some other place, should be attended to before you agree to any move. Like I said, if you have unanswered questions and no one can answer them, then I suggest you not accept that placement. If you don't think that it's going to be safe, don't take it at this point, because safety is paramount. And we've already had reports of folks dying that have been transferred out of Laguna Honda recently, and transfer trauma is a real thing. And hopefully Laguna Honda and all the staff there and all the people who are part of this process of moving residents will be more careful about this now, having had some tragic outcomes. All of your concerns should be allayed to some extent. or at least accounted for. And if they're not, then I think you ask them to move on to a different plan.
Okay.
Thank you. All
And
right.
put it in writing?
Yeah, of course. Yeah, of course. And I think it's real important for all of you to have your exchanges as much as possible with the staff in writing. And even if if they call you up and you have a phone conversation that's obviously not in writing, when you hang up the phone, you type up, hey, I just want to make sure I got all of this correct. This is what you agreed to do. This is what I agreed to do. This is what you said. This is what I said. If any of this is incorrect, please let me know. Otherwise, I'm going to assume I got it right. So you can follow up conversations with something in writing that verifies it and locks it down.
Okay, thank you.
I'm a lawyer. I've been a lawyer for a long time. And what I tell everybody in almost every situation, it's better to have it in writing every time. Yeah.
Thank you. All
Thank
right. Kelly Stewart, would you like to unmute yourself?
Hi, thank you so much for taking the time today, everyone, to help us out. I think I'm a little bit different than everybody. I'm actually have a brother who's in the Bay Area, but I need him to be down here where I am in San Diego. So my question is, one, will they cover the cost for him to be relocated? I looked up 36 places. I went to a website for Medicare, and it listed places based on my zip code. I chose places that had a 5-star rating or higher. I am gonna, make my trips and make sure that these 5-star ratings are legitimate. But the main thing is, if he has to leave Laguna Honda, and I'm hearing you guys say people going to LA and stuff, I can request for him to come here, because it would be a lot easier for me to visit him versus just telephone calls.
Yeah, I think that you're one of the people that Laguna Honda should be reaching out to right now and working with you. You're somebody that is amenable to the idea of having the resident move, and you're in a metropolitan area that has a lot of nursing home or other long-term care facility options. So
Yeah.
I think you're in a pretty good position. I don't know about covering the cost of the transportation. I don't know what the proposal is for that. Certainly it's a consideration, and I think that there's probably a way that you're not paying for that, or your relative's not paying for that. This seems like a situation where I would think Laguna Honda staff would be more than willing to work with you to try to find something suitable in San Diego.
Well, the thing is, Tony, I haven't heard anything as of yet. I have a caseworker who is not very helpful. So to your point, my mother taught me documentation beats conversation every time. So she's a little bit whatever. So I just got to the point where I don't talk to her. Everything gets sent in writing, whether it's good, bad, nasty, whatever. I send everything in writing, and she has to respond. So I have the documentation if I need to, take it to the next step. But my thing is, if they're telling people they're gonna move them from San Francisco to LA, like, they got to get there somehow.
Yeah.
I think they have to cover it. I can't promise that that's the case, but my feeling is if they're moving people and they're looking all across the state because they're desperately trying to find beds, there's no expectation that if your brother receives Medi-Cal, he will not be asked to pay for that move, and you can't be asked to pay.
Okay.
As his sister, you don't have any legal obligation to pay for his care.
Well, no, and I can if I want to, honestly, Elizabeth, because I myself am recovering from a brain tumor and a stroke. So I'm on SSDI, so I don't have the money to do it. And so I just want to make sure that they're not gonna try to BS me, because like everybody else, Laguna Honda's nice. I'll just be honest, my opinion is that's a nice piece of property. They could put a fabulous resort up there and shut that down and be done with it, redo it, whatever. It's over 100 years old. So I have my thought process of what I think is going on. But yeah, I just like everybody else, I just want to make sure that where he goes to, because again, my brother, same thing. He can't do anything. He has to have somebody, help him with the restroom. He can feed himself. He does things.
Kelly, I'm so sorry to interrupt you, because we don't want to share too many personal details about residents of Laguna Honda, since this is a public meeting and we're recording and posting to the internet.
Okay.
Do you have a follow-up question? Because we only have a little bit of time left, and we do.
That's fine, sweetie. I'll go so somebody else can go. I apologize.
No, you're okay. Thank you. Betty?
Yeah, thank you. I just wanted to bring up something new that I just personally heard about yesterday, and then it was in the Examiner today, where they have to reduce 120, maybe is the number of residents, because of some law about only 2 beds per room. And Laguna Honda, as far as I know, many of the rooms have 3 beds, even though the rooms are very large, and it's each person has kind of their own area. But is this something that we also need to worry about or appeal or whatever? Because it doesn't seem right for Laguna Honda. That's all.
It is true that Laguna Honda, when they get if they're going to get recertified, they're not allowed to have 3 residents sharing a room or a bathroom. But that's not a concern anymore. The census is already below the 120 bed reduction from what they're certified for or what they're licensed for. So that should not be a concern at all anymore.
It's also that Laguna Honda was grandfathered into, nursing facilities are not allowed to do that. So Laguna Honda had already a special dispensation from CMS. And so that's not something that, that has moved nationwide. And so Laguna Honda had gotten permission to not follow that rule, but they have to now.
But if they get, as of November 2016, if you are being certified for Medicare or Medi-Cal, you have to have 1 bathroom for 2 residents. And if you're going to get recertified, and that's why this came up, they assured us yesterday that when we had the Great Panthers had a town hall. This is Pat McGinnis. I'm sorry, I'm very sick right now, but I wanted to listen in. That there is not a quota per se, but they do have to abide by the CMS rules and regulations of having 1 bathroom per 2 residents. And I guess they do have that. I know that their census has been reduced significantly. So you don't have to worry about the 120 bed issue.
Alrighty. Next up, Ron Stuhler, would you like to unmute yourself, please? Thank you.
Yes, hi. My name is Ron Stuhler. I'm a representative, advocate for a resident up at Laguna Honda. I'm a real good friend of her, and all of her family is back in Chicago. And somebody put in the text earlier, I just want to throw this out there. What if you're a resident up there and you have no family or advocate for you? Where would you go? I'd like to see that answered. Another thing is somebody put in the chat that social media is really what we need to look into at this point. Because what I'm hearing right now is so refreshing from what I heard on Monday night. I was hearing everything it was like all set in stone, and there was no leverage, as Tony says, or no options. And so this has really been a breath of fresh air. I would like to hear from people moving forward on what they're doing, what's going on, anything that's happening. And I was once at Kaiser Hospital, a weight loss thing, and it was a big group of people. And one of the women up there got together a Facebook page where everybody that wanted to be on that page could be on that page. And people would text with things they were doing that would help and stuff like that. And I would like to see us do that as a group, whoever wanted to be on it, so that as these stories come up or advice or things that happen could be shared amongst everybody, and that we could all stay on the same page and get the information that we need. Because information really seems like it's the key right now to knowing what to do next. So that's my input. I don't know how to do it, but I would be willing to try, because the women did it up there. And I do have Facebook. I don't use it much, but I could get that together if anybody else would know how to go about suggesting what's the first step of doing that is. So I just think that would be very helpful. Information is key. That's the way I look at it. So thank you very much for everything that's going on today. Thank you.
Thanks. A couple responses on the issue of residents who don't have family and don't have representatives, but probably need them. There's state laws about that. CANHR's been very involved in the development of the state laws on how decisions are made for folks in nursing homes who don't have capacity to make those decisions, for family members to help make those decisions. I worry about them too, and I'm sure that there are some of those folks at Laguna Honda. I imagine they may be the first ones that get transferred. That we do know that
That's right.
a large number of residents are under the are conserved by the public guardian's office, San Francisco Public Guardian's Office. And I'm going to be talking with the public guardian very soon. I think there's probably other residents there who are conserved. We heard from a family member conservator today. But yeah, I think that's just sort of an open question. I think the issue of comparing this to Monday and how this has been revelatory in terms of nothing set in stone, I think that's the key, is that nothing is set in stone. We do know that the facility is decertified. We know that they are getting temporary funding through an extension from CMS for at least 4 months, and it could be extended 2 months beyond that, so a total of 6 months into November. And we know that the facility was obligated to create a closure plan that calls for moving all the residents out. As far as where the residents go and when they have to be out, that is not set in stone. Banding together, I'm hoping that the folks, that's not something that I think that CANHR's really available to lead at this point. I hope it's more grassroots from the Laguna Honda family members. Hopefully in the chat, people are noting who might be available to sort of lead an effort or coordinate an effort to keep everyone banded together in some sort of group way.
Well, Tony, Joseph Urban, who's on here too, he has put together that petition.
Yeah, and I think if you sign the petition and then the way I signed it and I had to register with my email and name and all that stuff, that could give could be the starting point for an outreach list, and you could use that, and maybe Joseph can help us put together a list, and then we reach out.
Are you on here, Joseph?
Yes, I am.
Oh, could you speak to that just briefly so that we could get to other questions too?
Yes, sure. So I just posted the survey in the chat, so everybody has an opportunity to click on that link. Sorry, the petition, not the survey. And my objective is to get this in front of Secretary Becerra to be able to have him influence CMS to delay or at least decouple the relocation from the recertification process. He does have that discretion. So I've had a lot of conversations with politicians throughout the Bay Area. Some of them I know personally, so they've been taking my calls. And the goal here is to demonstrate that there's public support beyond just the political support. So right now they've done everything they can. There's a lot of activity going on behind the scenes. A lot of effort is being made. But what's missing right now is the public face and the public pressure. So that's what this petition is intending to be. So hopefully, we'll be successful there. Thank you. We got probably more than 25 people signing during this meeting alone. So if everybody else can take action and do that, this will be the way to voice your opinion and get some movement there.
Well, the other thing that you mentioned last night, Joseph, is that a lot of the residents and family members at Laguna Honda are not aware that they do have rights. And so one of the things that we need to do is to make sure that people are aware of the right to appeal, that they can object to the transfer on certain grounds. And I think that's one of the issues that we have to deal with as well.
So actually, Pat, the one that is true. I agree with that as well. But the one thing I was very disturbed about during my walk through Laguna Honda this past weekend was just how few family members even knew that this was going down. So that was very sad, and so I'm sure there's effort being made, through email and other ways to communicate this. But I am very concerned that a large portion of people are going to be shocked at the very end that this is going down. So just to be aware of that.
Thank you.
Thank you. And Pat, you're actually up next. You have your hand up. Oh, would you like to unmute yourself?
I would like to unmute. I'm sorry, my voice is cracking. He wanted to know if whether transfer trauma was a legitimate reason to appeal, and no, it's not. Basically, it's that the relocation plan is unsafe, or you're going to be too far away from family, et cetera, et cetera. And of course, the other issue was that you do not need that level of care. But even that is, questionable, because we have not seen a site that, I mean, that this is according to the department, but we haven't seen a site that says those are the only two reasons that you can protest. But I don't think transfer trauma would be a legitimate reason. And the other thing I wanted to say is that we do need to organize. And I think through that petition, and if we have people's names, if there's a way to get leaflets out at Laguna Honda to let the family members and the residents know what's going on, that would be very helpful.
Thank you.
Yeah, on the transfer trauma, I just want to mention that I think transfer trauma is going to be unavoidable in every discharge or transfer. It's just, it happens. I think the key is on an appeal situation is, was every reasonable effort made to minimize it? And that's where I think you might have some grounds, among many other grounds, in your appeal.
Thank you. Next up, Judy Hinton. Would you like to unmute yourself? No. Alrighty. Rodney Hamlet, you're up next. Oh.
All right, there we go.
Great.
First of all, thank you for putting this town hall together. A lot of good information being passed. And I agree, we need to have some sort of support group so we can keep abreast on what's going on, share ideals, activities, information, et cetera, et cetera. But one of my biggest questions is, and I heard this from one of the staff on my brother's ward, that Laguna Honda, the hospital and land, was donated to the city. And they're under the provisions that the hospital would always stay open to care for the not homeless, the elderly and the downtrodden. Is that true, or did I hear wrong, or does anybody know? Because if they're not supposed to sell the, or not supposed to close the hospital on the property itself, that's in violation of the original request, I would imagine.
I think the problem is with that this it's funded by Medicaid and Medicare dollars.
Correct.
And when those go away, the facility would have to continue to be run through like San Francisco general fund. So it's a money issue.
The general funds coming from the city plus any type of leverage resources.
Right. I mean, I think that there's, so far we haven't heard that San Francisco feels that it's in a financial position to fund the facility without those federal dollars and state Medicaid dollars. And we haven't gotten a clear answer, like what happens if Medicaid and Medicare go away, people are still there.
Well, they have no sustainability plan, is what it sounds like.
As far as we know right now, I think there was cost. Tony, what did they say about how much they think it would cost the city?
To run it from city funds, $15 million a month.
Yeah.
There was a board of supervisor member at the town hall last night that the Gray Panthers hosted, and she did say that they could do that for a bit, but they could not do it on the long term because the bulk of their money does come from Medicare and Medicaid.
Right, it's probably formula based.
Well, yeah, it's a distinct part skilled nursing facility, so they do get more Medicaid funds than your freestanding nursing homes and all of that. But nevertheless, I don't think this is something the city alone could take on a long-term basis. No.
Okay, thank you.
Thank you. All righty, last one, Jennifer Palmer. Would you like to unmute yourself?
My question that I have been saying over and over and over again, which I don't really expect anybody to be able to answer it right now, is how did Laguna Honda get to this point? Because to me, an establishment as big as Laguna Honda and as long as Laguna Honda has been in existence, how did it get to this point where 700 plus people are now going to be displaced, homeless, or whatever, wherever they're trying to just shove people. And it's like, it's very frustrating, and very concerning.
Yeah, well, we could do a whole town hall on just that, probably a book on just that, how we got to this point. Obviously, there's been a lot of long-standing problems that went unaddressed for too long. But I think at this point.
Tony, this
Yeah.
is Benson, the Ombudsman. I want to say something.
Okay,
Family members are going to be coerced, influenced, pressured to rush for a decision. In yesterday's stakeholder meeting, we heard that the consultant for Laguna Honda is saying that a no is treated as a soft no, and we'll try to get them to change their mind. As the Ombudsman, everyone should say no.
Yeah.
And secondly, for those underrepresented or residents who don't have family, we Ombudsman will be trying to reach all those people that are their own decision makers to try to stand their ground and to not take what's offered to them, but to basically insist on choice and say no. Laguna Honda is a safety net nursing home. It's public. They have all sorts of residents who were historically denied by other nursing homes in surrounding counties, people with MS, people with Huntington's, and et cetera, et cetera, et cetera. So to expect to find a bed where those specialized needs are going to be addressed is erroneous because of the premise that Laguna Honda is taking people historically that no one else has been able to take care of. So it's a tautological error to assume that these beds are going to be to fit the specialized needs of residents in the safety net nursing home.
thank you, everybody, for participating, and especially to the agencies that have provided some folks to work with us through the Laguna Honda problems and through the town hall. I wish you all the best, and feel free to call us, to call our partners. We'll do the best that we can to help you through this difficult time. Take care, everybody.